notice our people get a very bad health-seeking behaviour.
As
you dey, we dey talk say body no be wound. Anybody wey dey shake him body, dey go work, dey stress himself, even our food sef no too good. Sometimes e go too much for the body. So if you no check your body once a while, how would you know that something is going wrong in your body?
Wọ́n ní bàbá jí, à ń já sókè, à ń já sílẹ̀, à ń lọ síbẹ̀, à ń lọ sọ́hùn. Àwọn oúnjẹ tá à ń jẹ gbà mí, àwọn oúnjẹ yẹn gan tún pọ̀ jù fún ara wa. Yípé tí a bá ṣe àyẹ̀wò ara wa, a lè mọ̀ pé nǹkan kan tí ó ti wàhálà kan ti ń ṣe nìkan láàrin ara wa.
Sometimes when we're in the house, when we feel feverish, or we feel headache, or we have cough, we just give ourselves malaria. Who tell you say you get malaria? How you take know say you get malaria?
I live in Ladegboye. This is Ladegboye community. And today we are organizing an health show. We want people to come and check the level. A lot of people do not know their health status. And we want them to come and check it so that they will be conversant with it, so that they will know which drug to apply at a particular time.
A dúpẹ́ lọ́wọ́ Ọlọ́run fún àǹfààní tí gọ́ọ̀mẹ̀ntì gbé wá fún wa yìí. Wọ́n help wa gan-an, wọ́n ràn wá lọ́wọ́ torí pé kíni àtọmọdé àtàgbà wa òun ni wọ́n dá lóhùn. Àní nǹkan tó dẹ̀ jẹ́ pé nǹkan tó wà fún wa ni pé instead ká ṣe máa sáré kiri tàbí kẹ́lómi máa lóhùn wá owó tó máa lọ fi ṣe irú nǹkan tá à ń ṣe kò sí yẹn ń bẹ̀. So a dúpẹ́ lọ́wọ́ Ọlọ́run, gọ́ọ̀mẹ̀ntì wa wọ́n help wa gan-an. Tí wọ́n bá tún lè ṣe jù báyìí lọ sí fún wa, inú wa tún máa dùn ni.
With our experience with what we have seen today, we discovered that so many people are sick in this community. Many people are sick. I've just been told that many people are experiencing high blood pressure, many are having diabetes, many are feeling pains all over their body. And so this kind of exercise is actually good for us. And if you look at this community, there's no medical center. In fact, about 2 to 3 kilometers away from here, you cannot access government medical services. And that is a serious concern to us as residents in this community. So we are appealing to the government to please come to the aid of this community to start a medical center, no matter how small it is, so that will cater for the health of the people around here.
The church decided to do some prayer, organize some prayer outreach within the community. And I, being a nurse, now decided to bring up the medical screening aspect to the outreach, the community outreach. And I needed assistance, so I had to now consult with Mr. Collins Ogboli, the coordinator of the Lead North Africa. And here today, we are here conducting this medical outreach, screening the health of the people, so that from this level, we can give them referral to go into either the primary health care center that is around this community of Ladegboye, and those that will need to go to the general hospital for further consultation. So I want to say a big thank you to Mr. Collins Ogboli, the coordinator of the Lead North Africa, for the support that he has given to Ladegboye community.
Ogbolu Collins. I'm the coordinator of Lead North Africa Public Health Project that is currently going on around Lagos, titled Slumnurse. We are going to vulnerable communities, trying to advocate for change in their health-seeking behavior so that they can have a positive health-seeking behavior. Now, one of our discoveries in this project is that sometimes members of these remote communities tend to give themselves, their own diagnosis. They have a whole lot of misconceptions about disease conditions and how to handle it. So it is our responsibility to come to this community and help them to understand, teach them the importance of routine health checkup, And then our specific focus in this program is control of diabetes, mellitus, and hypertension, and then common childhood diseases, teaching the parents and their mother how to manage these conditions. So it's been a successful one. We have the Director of Nursing Service Lagos State inviting us to provide technical support, and we are happy to partner with this community and with the church in giving this healthcare to the vulnerable members of their communities. And we intend to go around Lagos State in all the slums to do the same, to carry out similar projects. Now, the project became an urgent because the truth is that in Nigeria, the health-seeking behavior, Nigeria has one of the worst health-seeking behavior in the world. The worst health-seeking behavior in the world. And this thing has been complicated by our religious and the social belief. So these whole factors have come together to complicate their health conditions. So in most hospitals, the data we are getting is that most diabetic cases, late presentation, hypertensive cases, late presentation. So if these communities can begin to understand what this is all about, how to detect it early enough, and action that should be taken when the conditions are building up, then they'll be able to live as long as possible.
So far, the health indices of this community has gone a little needs a lot of enlightenment because of the locality of the environment and based on the rural setting. However, the health point strategy that we adopted by Lead North Africa today will facilitate the sustainable development of healthcare services within the community. And I pray this will be sustained as the organization continue with this strategy. So we appreciate it. Thank you so much.
wọ́n á sí ọ̀dọ̀ àwọn elétò ìlera wọ́n á bá mi wọ́n ṣe àyẹ̀wò ara mi mo dẹ̀ dúpẹ́ fún wọn mo dúpẹ́ lọ́wọ́ wọn mo dẹ̀ dúpẹ́ lọ́wọ́ Ọlọ́run pé wọ́n ní ara mi wà òkè pé mi ní problem nípa ẹ ṣé gan ni.
The Lead North Africa decided to visit Aboru community because after the feasibility study that was conducted last month in this community, we noticed that there was increased infant mortality rate and mobility rate, and also increased maternal mortality rate in this environment. The reason is this: it's not far-fetched. We all know that Aboru is situated in a very swampy area. We have canals surrounding Aboru, and the roads are not pliable. So whenever the rain comes, especially in this season we are, we noticed that everywhere is so swampy. And we know that these areas promote the breed of mosquitoes and every other thing that can breed in dirty, waterlogged environments. Today, the focus of the public health promotion was on hypertension, diabetes, and HIV/AIDS. Most people don't even know what blood sugar or sugar in the blood is, what it means, or diabetes is. And also, the HIV/AIDS. People don't really know that they should at least check for their status, not because they have it or they are sickly. It's just so that they can know their HIV status. So the medical checkup that was done today was on this tree-related diseases or disorder.